So I was at work on 9/11. Early in the morning, one of my colleagues came running into my room to let me know that a plane had just struck the World Trade Center. We finally found out, of course, what was going on, that this was a terrorist attack. My daughter, Helena, was in school 2 blocks away from the World Trade Center. One of our neighbors that would walk Helena and her son to school, she said, "Can I take Helena?" They left together. They got caught when Tower 2 came down and had to run for their lives not to be caught in the cloud. I'm in Staten Island trying to figure out how I'm getting home. The bridge is closed. I'm trying to rent a boat to get across the water. They're telling me from the services that, don't worry, everybody downtown's been evacuated. That was not true. So I finally made it home. I came up, we hugged, we kissed, and then I said, okay, everyone's all right here, but there was this much dust on the floor in here, and we faced the East River, and all the windows were closed. You know, what's next? Where do we go from here? What about the children? Many of the parents didn't want to let their kids out of their sight. Many of the parents didn't want the kids to relive the experience, so would not sign the kids up. And with the registry, that was our biggest problem, was that group. And this was the group that we were most concerned with. I encouraged everyone I knew, sign up for the registry, because 20 years from now, you don't know what kind of condition you're going to be in. Now, I'm looking at myself, and even though my mother passed away from pancreatic cancer, they tested me. I don't have the gene. The only other thing that flies in the face of this is what caused this pancreatic cancer for me is 9/11. The creation of the registry was key to getting the future services and a handle on the scope. And that's why I think that it was really important that the registry was created and still exists, because we didn't have money to do many of the studies that were eventually required. So what we had was organizations would apply to the registry for access to the data. We began to get the necessary research into the ancillary effects and direct effects of the poisoning of our air. And I think that my voice went a long way. I think that the people keep in touch and fill out the questionnaires each year are being smart, because down the road, like me, when you all of a sudden find yourself with a life-threatening illness that could very well be related, how are you going to know? You're going to start playing catch-up? No. You should stay connected, and you should make sure that when you have important information that you share it. I was the poster boy for the 9/11 program in the beginning. When I tried to sign up for the 9/11 program, my friends at the registry reached out and offered assistance. There are those of us who see this as a public responsibility. You know, people say to me, well, why do you do what you do? And I said to them, if you need to ask me, then you'll not understand.